Health Insurance Essentials. Learning objectives. Remember that the learning objectives are the items that you are going to be learning throughout the lecture and through reading of this chapter. And they are as follows. Lesson 15.1, Health Insurance Essentials. 1. Discuss the purpose of health insurance and discuss the concept of cost sharing. 2. List and discuss various government health insurance plans. 3. Summarize private health insurance plans. 4. Review traditional fee-for-service health insurance plans. 5. Differentiate among the different types of managed care models. 6. Outline managed care requirements for patient referral, obtain referral documentation, and discuss utilization management. 7. Describe the process for pre-authorization and how to obtain pre-authorization, including documentation. 8. Discuss participating provider contracts, including contracted fee schedules. 9. Interpret information on a health identification ID card. 10. To explain the importance of verifying eligibility and be able to find services, including documentation. 11. Describe other types of insurance, including disability life, long-term care, and liability insurance. And 12. Discuss the Affordable Care Act's effect on patient healthcare accesses. The purpose of health insurance. It helps individuals and families offset costs of medical care. It's defined as a contract for protection against financial losses resulting from illness or injury. It provides payment or monetary benefits for covered sickness or injury depending on the policy purchase. Policy is purchased with a premium or payment. There are various types of health insurances such as accident insurance, disability income insurance, hospitalization, medical insurance expenses, and accidental death and dismemberment insurance. While most insurance policies do not cover elective procedures, such as certain cosmetic surgeries that are not considered medically necessary. Cost sharing. Most policies require a patient to pay a portion of healthcare expenses. These would include deductibles, coinsurance, and co-payments. A deductible is a set dollar amount that the policyholder must pay before the insurance company starts to pay for services. Coinsurance is after the deductible has been met, and it's usually in a percentage amount. And a copayment is a set dollar amount that the policyholder must pay for each visit. In order for the insurance carriers to pay for services, a claim must be submitted. Benefits. There are 10 categories of essential health benefits. They are ambulatory patient services, hospitalization, mental health and substance use disorder services, prescription drugs, preventative and wellness services for chronic diseases management, emergency services, maternity and newborn care, rehabilitative and habilitative services and devices, laboratory services, and pediatric services, including oral and vision care. Health insurance plans. There are 2 types of health insurance plans in the United States. You've got your government health insurance plans and private health insurance plans. Then you've got medically necessary services, are those that are necessary to improve patients' current health. And then your elective procedures. These are medical procedures that are not deemed medically necessary. Preventative care could also include services to provide and to help prevent certain illnesses or that lead to an early diagnosis. With your preventative care services, these are some of the items that would be covered. Alcohol misuse screenings, blood pressure screenings, cholesterol screenings, colorectal screenings, depression screenings, diabetes type 2 screening, diet counseling, hepatitis B and C screening, human immunodeficiency virus HIV screenings, immunization vaccines, lung cancer screenings, obesity screenings and counseling, tobacco use screenings, and sexually transmitted infections, STIs, prevention counseling. Then you've got your government health insurance plans. These are patients need to qualify by either by age, income, government occupation, and health condition. Patient who is 65 or older can qualify for Medicare. Low-income patients may be eligible for Medicaid. And remember, Medicaid is a universal language for it, where, for example, the state of California has adopted the name Medi-Cal. Then you got dependents of military personnel are covered by TRICARE. Your government health insurance plans provide coverage with reduced or no monthly premiums for the indigent, the elderly, the military, and government employees. Surviving spouses and dependent children of veterans who died in the line of duty are covered by the Civilian Health Medical Program of Veterans Administration, also known as CHAMP VA. Medicare, federal health insurance program that provides health care coverage for individuals who are age 65 or older, people who are disabled, and patients who have been diagnosed with end-stage renal disease, ESRD. And there are 4 parts to Medicare. Your first part, Part A, is for inpatient hospital care, skilled nursing facilities, home health care, and hospice services. Your Part B is outpatient hospital care, ambulatory care, durable medical equipment, provider services such as office visits and clinic visits, and any other medical services. Your Part C is option for Medicare qualified patients. It's expanded inpatient hospital and outpatient care benefits, and it's usually that the patient would sign over their Medicare benefits into some sort of a managed care plan, such as Secure Horizon 65, Pacific 65, and those type of managed care options. And your Part D is basically your prescription drug coverage. So it covers the prescriptions themselves. Okay, with Medicare, the basic medical coverage for Medicare Part B is 80% of the allowable amount after the deductible has been met. Then you have your resource-based relative value scale, your RBRVSs, and that also is off of the allowable amount. Fee schedule systems consist of 3 parts: the provider's work, charge-based professional liability expenses, and charge-based overhead. Medicaid. Medicaid is a government program that provides medical care for the indigent or the low income. It's funded by federal and state governments, and the mandatory Medicaid benefits that will cover would be inpatient and outpatient hospital services, nursing facility and home health services, early and periodic screenings, physician services, rural health clinic services, family planning services, and transportation to medical care. Now, the word Medicaid is a universal language that is used amongst the United States, where each state has adopted their own name, such as California would be Medi-Cal. With Medicaid, eligibility is determined by respective states. Most Medicaid recipients are either low-income families, qualified pregnant women and children, recipients of temporary assistance for needy families, also known as TANF, individuals who receive supplemental security income, SSI, individuals who receive certain types of federal and state aid, individuals who are qualified Medicare beneficiaries, the QMBs, and individuals in institutions or receiving long-term care. Government managed care plans. Medicare and many Medicaid programs offer their members an option to join a managed care plan. The identification cards will look just like ones issued to people not on Medicare or Medicaid, and it may have a copayment that the patient must pay and are responsible for. Children's Health Insurance Program, also known as CHIP, it's a state-funded program for children whose family income is above Medicaid qualifying income limits. Some CHIP programs cover routine checkups and doctor visits, immunizations and prescriptions, dental and vision care, inpatient and outpatient hospital care, laboratory tests and x-ray services, and emergency services. TRICARE. TRICARE is a comprehensive healthcare program for uniformed service members and retirees and their families. It's managed by military in partnership with civilian hospital and clinics, and is designed to expand access to health care, ensure high quality of care, and promote medical readiness. Now, TRICARE offers two types of plans. You've got TRICARE Prime and TRICARE Select. Civilian health and medical programs of the Veterans Administration, also known as CHAMP VA. These are health benefit programs similar to TRICARE. It provides coverage for families of veterans who were permanently disabled or killed in the line of duty. And the Department of Veterans Affairs, the VA, shares costs of certain healthcare services and supplies with eligible beneficiaries. Workers' compensation. Now, workers' compensation is an insurance plan for individuals who are injured on the job or become ill to a job-related circumstance. It covers medical care and rehabilitation benefits, weekly income replacement benefits, and death benefits to dependents. All 50 states have passed workers' compensation laws to protect workers against the loss of wages and the cost of medical care resulting from an occupational accident or disease, as long as the employee was not proven negligent. Now, one of the examples that you can be is if you are a truck driver and you are driving cross-country doing a delivery. As long as you are on the clock and being paid for your services, this still would be considered worker compensation. You do not need to be on the premise of the job to qualify for workers' comp, as long as you are on the payroll clock. Private health insurance plans. You've got employer group plans, self-funded group health plans, and individuals health insurance plans. Health insurance plans that are available from commercial plans companies are considered private plans. In a self-funded group health plan, they often are a third-party administrator that handles the paperwork and claim payments for a self-insured group. An individual health insurance plan is one that is not offered by the employer or another group. These policies can be purchased through a health insurance exchange or directly from an insurance company. Traditional health insurance. With traditional health insurance, they will pay for all or a share of cost of covered services. There are fee-for-service plans. They provide most flexibility for patients. It's the costliest, and the fee-for-schedule amounts can be determined by a process called usual, customary, and reasonable, also known as UCR. UCR is the amount paid for a medical service in a geographic area based on what providers in the area usually charge for the same or similar service. Your matched care organizations. These are health insurance companies whose goal is to provide quality, cost-effective care to its members. They negotiate reduced rates with contracted providers and hospitals. Many require a patient to choose a primary care provider, a PCP. It will require referrals, which referrals are the requirement that is needed in order for a patient to go from their primary care physician to a specialist. And pre-authorization process can further control patient care. The models of managed care organizations. Patient care is coordinated through a network of providers and hospitals. They have types of health maintenance organizations, your HMOs, your preferred provider organizations, your PPOs, and your exclusive provider organizations, your EPOs. They will provide health care in return for scheduled co-payments and coordinated health care through a defined network of PCPs, hospitals, and other providers. Health maintenance organizations, your HMOs. The health plans that are regulated by HMO laws. The goal is to reduce costs of healthcare while still providing quality healthcare. Typically, they have the lowest monthly premiums and lowest out-of-pocket expenses. The patients have to pick a PCP, and the insurance plan will not pay for services that are not included in its provider network. Now, patients are 100% financial responsibly for medical expenses that incurred outside the HMO network of providers. HMOs can be set up using several different models, such as at the Independent Practice Association, the IPA. The structure of that is the general or family practice provider or provider group that practice independently and may contract with several HMOs. And they do and can see patients outside of an HMO. You've got your staff model, which is one or more providers are hired by an HMO, and that provider will see only HMO patients. Then you got the group model, which is multi-specialty group with or without a primary care provider, and they may contract with several HMOs. And then your networks model, HMO contract with multiple provider groups. Those providers can see patients outside of the HMO and provides a wider geographic coverage for members. The next one is your preferred provider organizations, your PPOs. Managed care network that contracts with a group of providers, and they agree on a predetermined list of charges for all services. They use the fee-for-service concept, and typically a patient's financial responsibilities are 20 to 25% of the allowable charge. The PPOs provide their subscribers with a list of participating providers and healthcare facilities from which they can access in a network healthcare at PPO reduced rates. Although patients have the option to visit a specialist when they feel they need, they are still required to obtain a pre-authorization for more expensive services, such as diagnostic imaging. The exclusive provider organizations, your EPOs, they combine features of an HMO and a PPO. Patients with an EPO will not be covered for services outside the designated network of providers. May not need to obtain a referral for specialized care. The EPO plan members not required to choose a PCP. Referrals. There are 3 types of referrals. Regular referral is 3 to 10 working days. Urgent referral takes about 24 hours. And a stat referral can be approved online for emergencies. The regular referral is the most common type and can be inconvenient for the patient. With most managed care plans, pre-authorization needs to be obtained for a referral. Utilization management or utilization review. Utilization management is a form of patient care review by healthcare professionals who do not provide the care but are employed by the health insurance company. The Utilization Review Committee reviews individual cases to ensure that medical care services are medically necessary. The medical assistant should contact the Utilization Review Department directly. It should never be left to the patient to contact this department. Pre-certification and pre-authorization. To obtain pre-certification, the medical assistant will call the provider services phone number on the back of the patient's health insurance ID card, provides insurance companies with procedures and or services requested and the diagnoses, and the documents the outcome of a call in the patient's health record, including pre-certification number. The pre-certification does not guarantee a payment of services. Each insurance company has its own pre-certification requirements. Pre-certification and pre-authorization processes are very similar. Participating provider contracts. With all government health plans, and most private health plans, healthcare providers must become participating providers, also known as PAR, also PARs. The healthcare providers can apply to become PARs through a process called credentialing. Once a healthcare provider is credentialed, the health insurance plan issues a contract to become an in-network participating provider. Credentialing is a process of confirming the healthcare provider's qualifications. By signing the contract, the provider agrees to accept the health insurance plan's fee for schedule, even if it is lower than the provider's fee schedule. Contracted fee schedules. When setting up a fee schedule, a healthcare provider considers the time, the expertise, and the services. Providers must place an estimate on value of services, and an allowable charge is the maximum dollar amount that the insurance plan will pay for the procedure and/or service. Payment for services is typically made after the health services are provided. The health insurance identification card. Supplies. You have your health insurance company, the health plan name and type, the subscriber's name and covered dependents, the subscriber's identification number, co-payment amounts, the policy group number, and the health plan contact phone number. The medical assistant must be able to identify all of the information provided on the health insurance card. Verifying eligibility. The verifying eligibility is a process of confirming health insurance coverage for patients. The medical assistant should gather health insurance information and verify effective dates. Then, review each insurance online insurance web portal. Once approved, a patient's benefits can be looked up in their entirety in seconds. When you are scheduling an appointment, the health insurance information should be collected, unless it's an emergency situation. Disability insurance provides income replacement if patient has a disability that is not work-related. Short-term disability means that the patient is unable to work 9 to 52 weeks. Long-term disability is pick up when short-term benefits are exhausted. They pay out until patient returns to work or for a number of years specified in the policy. There may be a waiting period before benefits can be paid. Sick time can be used for the waiting period days. The medical office may be involved in the examination of the patient to determine the level of disability and when the disability ends. Life insurance. Life insurance provides payment of a specified amount upon the insured's death, either to his or her estate or to the designated beneficiary. Healthcare facility may be required to complete a physical examination forms when a patient is applying for life insurance. If there is an annuity policy, the provider may have to determine if there is a permanent disability and submit documentation. Long-term care insurance is relatively new. It covers a broad range of maintenance and health services for chronically ill, disabled, or developmentally delayed individuals. Medical services may be provided on an inpatient or outpatient basis or at home. Liability insurance covers losses to a third party caused by the insured. Some types can be automobile, business, and homeowners. It will often include benefits for medical expenses resulting from traumatic injuries, loss of wages, and sometimes for pain and suffering. All liability insurance policies are payable to victims injured by the insured's personal home or car without regard to the insured's personal actual legal liability for the accident. The Affordable Care Act was enacted in 2010. It increased quality, availability, and affordability of private and public health insurances for more than 44 million uninsured Americans. It works to reduce overall healthcare spending in the long run. Insurance companies cannot drop patients' health coverage if the individuals get sick or makes unintentional mistake. And pre-existing conditions are eliminated. With more Americans having health insurance, the number of office visits to providers across the country is expected to increase. Patient coaching and legal and ethical issues. Responsibilities include keeping patient informed and answering questions as they arise. Use good communication skills, patience, and tact when discussing third-party reimbursement issues with patients. A written release must be given for medical information to insurance claims processing. Understanding how insurance plans handle reimbursement of benefits is challenging both for patients and for medical assistants. If patients are well advised and comfortable with insurance facts before treatment begins, the medical experience will go more smoothly, and collection of fees not covered by the carrier will be easier. Verification of eligibility is a process that is important not only to ensure the insurance plan is valid, but to ensure patient identity. And this will conclude the lecture of Chapter 15, the Health Insurance Essentials.